Good morning. I'd like to start by first thanking Michael Wright and our IT team for being able to continue to support us so that we can provide these updates to the NeoMed community. I'm sure all of you have been following newscasts and social media and beginning to realize that we're in this for the long haul, and that the changes that we've had to make at NeoMed to improve our operational capabilities to be able to deliver education and to perform some of our research from home and other remote locations using video and internet-based sources has really become the standard for us that will now last for quite some time as we move forward. There have been a number of unintended consequences from the implementation of the programs put in place to flatten the curve, social distancing, and the executive stay-at-home order from the governor and from most governors across this nation now. And some of those are going to greatly impact us into the future for periods of time that we cannot yet well define. Aside from just the impact of the virus itself on the health of our communities and our loved ones, there's going to be a tremendous amount of fiscal impact. We're already seeing unemployment rates skyrocket, and they're expected they could reach as high as 20%. State dollars that are based on tax income are going to be dramatically reduced as we are no longer inside restaurants, purchasing automobiles, traveling, staying in hotels, and other activities that typically generate revenues for states to operate. And as a direct consequence, we expect the long-term impact will be that subsidies that have traditionally helped fund higher education here in Ohio will likely be in the future, and we've been asked to brace for that impact. Though that is not affecting us currently in how we're operating, we do know that is something we're going to have to pay a great deal of attention to as we move forward. And it's just one additional burden that we are being tasked with figuring out how to manage appropriately. So this is a good time for those of you in our community who've taken advantage of the great Lean Operations online training program developed by Sarah Berkeley and Leslie Tabler at our university. I want to thank those of you who are doing it. I'm told we've got about 102 of our individuals at home who are signed up and continuing to go through that course to help us be more operationally efficient and effective at what we do. I think we've all watched the escalation take place across our country. Unfortunately, in New York, where they are already overwhelming their healthcare resources and looking at having to make very difficult decisions regarding who to treat based on what their quality and long-term outcomes will be. In Ohio, the biggest number of cases were generated out of Cuyahoga County, where we had our 3 initial index cases. Currently, or at least as of yesterday, we were noted to have 1,653 cases, 139 patients in the intensive care unit, and 29 deaths. Now, you know there's a lag between presentation and ICU admission and deaths, so we know that those numbers are going to go up substantially over time. Here at NeoMed, we've had 2 confirmed members of our community now show positivity for COVID-19. The first of those is a researcher who had been present in our RGE building. The second is an adjunct faculty member. At this time, we do not believe they had contact on NeoMed's main campus prior to falling ill. Both are, as I understand it, at home and recovering and doing fairly well. The NeoMed exposure had 2 close contacts. One of those contacts has now developed classic symptoms. Remember, those symptoms are fever, cough, increased work of breathing or shortness of breath. Although we're seeing other types of presentations include upper respiratory infectious signs such as runny nose, stuffy nose, sore throat, and also some GI disturbances, which could include diarrhea. It could also include abdominal discomfort, nausea, and anorexia or loss of appetite. So we're asking everybody to be diligent and watch for these signs of the infection. We have an additional 4 individuals who are under quarantine who may have come in contact with the index here at Neomed or their direct contacts, and they've been asked to stay home and to follow CDC quarantine rules. So this is good that we've had a substantial reduction in the number of our faculty, staff, and students who are coming on to the Neomed campus. Thank you for abiding by the rules that have been set in place. Doing so has allowed us to markedly reduce the risk to our community, to you, and to your family members. I will say that it's been brought to my attention by our police force and by our operations team that we do still have very few individuals coming into the news center who are congregating very closely to each other. I understand you know each other and you feel comfortable. However, that would have been the same circumstance that was in place for almost everybody who's passed this virus on. You all come in contact with other individuals outside of the area. You're touching the equipment, the tables, the surfaces in the news center and in the environments that you were normally in, and you still have a great deal of risk passing this on to one another. Please abide by the separation rule if you need to be in the news center for the purposes of gaining access to the internet for your education. Otherwise, presence in the news center is strictly prohibited. It is only for access for students who need to be able to gain access to the internet to conduct their educational programs. The police chief has done an amazing job in working to keep our community and our campus safe and has met slight resistance where individuals are asked to separate, and when they return, the individuals have congregated again and are getting responses that it's not important for them to check their temperatures because fever isn't present in everybody with this disease. Please, this is not a time to rationalize. We know that everybody presents somewhat differently. These are the orders that have been put in place by the governor of our state and the director of public health. I ask that you please abide them for the safety of our community. It's true that most of you who are younger will not get substantially sick from this virus, but you become the vector. You become the way of spreading this on to those who are at risk. And the mortality and morbidity rate for those above 65 is substantial. And we certainly don't want that on our minds. It's our job to protect our community, especially as a medical university. We are here to take care of the patients and the community, to see to their health and their welfare. For those of you who will go out and practice very, very soon, for our graduating 4th years in pharmacy and in medicine, I can tell you that your alumni who are already out there on the front lines are not just asking, they're begging and pleading for you. Stay home, avoid contact, do everything you can not to contaminate others, to become sick, and to overwhelm our healthcare capabilities. Dr. Joe Zarconi has stepped up to serve in the role as medical director during this time of crisis. He has been coordinating with the Department of Public Health along with our nurse, Michelle Gawan. They are coordinating an effort to be able to grab all of the PPE that is available on our campus to ensure that we can get it out to our healthcare facilities and our first responder community. So I ask you, if you have some that have not been identified, please reach out to Dr. Zarconi today, as we would like to be able to get as much of this out as is possible for the health and wellness of our patients and for our community. It turns out we had a larger supply in some areas than we thought. For instance, we learned today that our food preparation team believes that they have over 9,000 nitrile gloves. That's something we hadn't thought about, but under normal conditions, we work to make sure that food is sanitary. So these are sources for you to think about. And we'd like Dr. Zarconi and Michelle Gawan to be able to work to get these out to where they can have impact in meeting the critical needs. As all of you know, personal protective equipment is really the rate limiting step for us right now. For our faculty, you know that there have been positive cases now up in the research laboratories. Please take every effort that you possibly can to avoid presence in those buildings if necessary. If there's mission essential critical research you must be there for, please go out of your way to maintain that social distancing and to wash your hands frequently, and do not touch the area of mucous membranes on your own bodies. That's what we call the T box. It's the eyes, the nose, and the mouth. It's really us really looking out for your safety and you looking out for your own safety. We are here to support you in every way that we can. Thank you for all the incredible work that you're doing supporting our online educational programs, which literally ramped up overnight when this crisis started. We cannot thank you enough for everything that you're doing for us. Questions have arisen with the IUC or the Inter-University Council leadership teams regarding faculty and how we'll manage the RPT process going forward. Rest assured that if we run into a situation where this becomes protracted and affects a faculty member's performance in a way that would affect their retention, their promotion, or tenure, we will have an extension period in place to be able to ensure that this does not affect your careers. We know that you're all wonderful and dedicated members of our team. To our staff, thank you for everything you're doing from home. Without you, we would not continue to meet all the mission essential requirements of running our organization. For our staff and our faculty, and for those students who do work, you are continuing to receive a paycheck, and that's because of the great work being done by our dedicated finance team. We're continuing to have a facility that's operating and operating safely due to our operations team. And we have a fully functional police force that is there for our health and for our safety. We have curriculum coordinators. We have an outstanding IT team all working hard so that we can present this information to you today, but more importantly, so that we can continue to communicate with you on a daily basis and that we can continue to educate our students and gain access to critical research materials. For our students, thank you again. We realize the sacrifices that you're making at this really critical period of your lives. We understand you've had to adapt very rapidly to virtual education, that it can be more difficult to have discussions with faculty members for advice, with curriculum coordinators for assistance. But I think we're meeting those needs fairly well, both through email, through phone calls, and of course, through our ability to interact virtually. Zoom has proven itself to be just an amazing tool for us. For our students who are getting into those years and those periods of graduation, I know that we've had to cut many of the traditional times of celebration, but we're doing everything we can to continue those just in a different way. The biggest issue that's hit all of us because of government mandates that were put in place for our safety is the canceling of traditional commencement. We've made a commitment to continue commencement and to make it extremely meaningful, but just in a different way. Sandra Emmerich and Rod Ingram have been working with the student leaders on campus, and they've drafted a plan that we will be sending survey information out to our students more broadly to get your input on. But we need you to do so very quickly once that survey comes out to you. We're hoping to get that out by end of day today, because the current plan that is in place will require us to implement this very quickly over about a 1 to 2 week period of time, so that we can continue maintaining social isolation, so that our ability to produce something unique and meaningful doesn't also put you at risk. We will also currently plan for having a more limited in-person activity, likely on July 26th, to recognize those graduates in a more formal celebration on campus who happen to still be in the area and can participate with us. We know that is going to be reduced because many of you are disbanding the area. You'll be taking care of patients, both in pharmacy and in medicine, and conducting research at other organizations across this country. We are truly excited to be able to share, though, that we have about 80 of our graduating physicians who will be here in Ohio taking care of Ohioans during this crisis. And it will not be over at the time that you start your practices. So you will be on the front lines, and we thank you for everything. 80 is an incredible number of new physicians to get out to this community. And our pharmacists, those numbers are going to be somewhere in the neighborhood of 60 plus who will be out there helping to man and provide person power to be able to support information on appropriate medication utilization, delivery of medications, and much, much more. Our researchers also helping to contribute to understanding this virus better and understanding ways for us to be able to mitigate risk, including those who are graduating in public health. We do ask that those students who've reached out to us regarding volunteer activities do this carefully and on your own. We've elected not to formally coordinate student volunteer services at this time, as you are all still undergoing a very intensive educational process here under a new format. So we are staying focused on ensuring your education is completed, just in a little bit of a different way right now. So please understand that your volunteerism is really meaningful, and there are many people in the community who are looking for that volunteerism, and feel free to continue to do that. Just make sure, please make sure that it doesn't affect your ability to continue to successfully navigate your coursework so that we can get you graduated and out into the community as soon as we possibly can, so that you can also contribute to the healthcare of our state and that of our nation. For our students who are graduating, many of you should be getting or will be getting some phone calls from the health facilities that you'll be joining. That we've had a number reach out to the deans indicating that they would like you to potentially start sooner, to transition you into their organization sooner so that you can deliver care to patients during this crisis sooner. That's not a mandatory decision right now. The government has not gone there, so it's elective for you. And these are difficult times. When you came into medicine, when you came into pharmacy, when you came into research, you didn't know about COVID-19 and the risks it poses to you as individuals, being in the front lines, being out in the community, taking care of sick patients. And we know that a large number of the patients who are coming down with this virus are healthcare workers. So we know you're putting yourselves at risks. Many of you have families, some of you have young children, and these are difficult decisions you will have to make on your own. But know that our deans are working hard to ensure that if you choose to participate early, that we can ensure that you get graduated and ready to go at the very soonest possible time. Currently, I'm being told by early May, you should be in a position where if the institutions work with you and the state governments allow you to participate, you can do so. Many of you have probably seen that Massachusetts and New York have already decided to move forward with their students who are graduating very rapidly. And for our third-year medical students and pharmacy students, you may be getting put back into the clinical setting as part of your education, because there's a mandate for us to do so. But please, as I said before, remember, we will not do that without ensuring your safety. And that means ensuring that adequate stockpiles of personal protective equipment are available and that you are adequately trained to use it. Because your health and your safety is first and foremost to us. I want to thank all of you really for everything that you've done for the university, for our communities, for our patients. And with that, I would like to open this up to any type of questions from all of you in the community.
Yes, the first question, do we know the financial impact of the new building construction yet? Is it still being constructed?
So the new building is still being constructed. Those dollars actually are not impacting the university's bottom line. Those dollars came from state support, and those dollars came from bonds. We already have individuals from outside and within the university that have allowed us to fund those. And so there is actually not dollars coming out of our coffers from student tuition or from research dollars that are supporting the building of that new building. In fact, we expect that once it's up and populated, not only will it cover the debt on the bonds that are going to be issued on this, but it will generate additional dollars through those leases to be able to support education and research programs. So overall, it should be a net positive for us. Now, I do know construction has reduced a bit because of the state rules in place. Some of the contractors are not coming in. My understanding in our last meeting is that some progress is still moving forward. There is there's funding for the Biomed Academy that has come to the state in excess of $12 million for that building. And they are counting on being able to start their classes up in that building sometime by late July. We also are very close to a signature to bring healthcare onto our campus that would expand healthcare to a much broader swath of people in different specialties, and will bring more patients onto our campus, more clinical training opportunities for our students, and it also means additional revenue generation in our pharmacy and in our food services that are available on campus. So the net impact, we hope, will be positive, and it will not be a drain to our organization.
With the 2 cases of COVID-19 on campus, are we all to assume we were in contact because we were on campus?
I would make the assumption that all of you are at risk daily for contact, not just on campus, but off campus. Remember, the positives in this state, the 1,653 as of yesterday, is an incredible underestimation. We have very limited tests. We're only testing those in tier 1 and tier 2 at this time. The CDC has set 4 tiers out, with tier 4 being asymptomatic individuals in the population. And we know somewhere between 80 and 85% of you are just going to have mild cases of the disease. We also expect that many of you will be completely asymptomatic. So you'll have to assume right now that you do have it, that you're carrying it. So I do not think there's any increased risk for the majority of people who've been on campus. It's only those who've had close contact, and the Department of Health in the local county has already investigated those and has already reached out to individuals they think may be at risk, and have asked that they also supply their contacts so those individuals can also be contacted about risk. Overall, it shouldn't change anything, because we're going to take people who are at risk and asymptomatic and tell them to essentially self-quarantine. And that's what we're asking all of you to do now anyway. Stay home, stay in contact only with yourselves and your families in your homes. And if you become symptomatic, the concept of quarantine goes to isolation, but it's really no different. You're going to stay where you're at. The only difference is you'll experience is if you're substantially symptomatic from it, then you need to get a hold of your physician or healthcare provider, ideally through telehealth, and figure out whether you qualify to be tested. And again, that still changes nothing. The only thing that changes, because we really don't have a treatment or a vaccine for this, is that if you become significantly ill and need to be hospitalized. But when you're at home, if you go from quarantine to isolation, meaning you become symptomatic, you need to make sure that you isolate yourself within your home. If possible, and you're in home with other individuals, go to a separate bedroom, use a separate bathroom, use separate utensils, try and stay at least six feet away from other contacts. Don't hug, kiss, or get close to your other family members. I know this is hard, especially when you have children, but it's what you need to do. And just remember, the majority of them will not become dramatically ill. I would say if you have high-risk individuals at your home, or if you have high-risk individuals in your family that you go to visit as part of this quarantine, that it's best not to do so now, because those are the people that are really having the problems with major hospitalizations, ICUs, and unfortunately with some of our patients dying.
What is NeoMed's plan to help students access telecounseling services at this point?
We have telecounseling services in place through our mental health programs that are already available. I know that we used to do these in person on campus. That is just not something we can do right now. If you require in-person attention because of severity on screening through the telehealth program or the behavioral health and wellness program, you will be referred to the appropriate resources. But those are available right now. And the state has really stepped up to help us. Broadly, telehealth is now being compensated by most insurers, by Medicare, and by Medicaid. And that compensation is one that covers everything from telenutrition consults, telephysical therapy, telebehavioral health and wellness, including standard telehealth screening and doctors and advanced practitioner visits. So it's broadly available across the state, and we do have it through our counseling, health and wellness services here on campus. Those numbers are available on the website. Additionally, Sequoia, our health and fitness community, is continuing to provide health and wellness capabilities to us, both right now virtually. They're sending out frequent notices, giving you access to websites, to wellness counseling, to computer-based training, and their intent is to work with the local county of health department to see whether we can step up some type of outdoor activities that meet the governor's and the Department of Health rules for keeping you safe. And so stay tuned and watch for that.
Are staff still able to come onto campus only as necessary, as long as we do not have a temperature of 100.4 plus?
That is true. Staff and faculty can continue to come on campus only if it is required for essential business. So, for instance, some individuals had to come on and pick up computers in order to do work at home. Others have had to come in and get critical mail where checks have been brought in that are there to fund the university, or they are there to work with ensuring the safety of our research facilities. That can all be done, but remember, the governor's office has given an executive order and they've clearly stated what qualifies to be considered mission essential. And if you are called out for doing something that is not mission essential, as our lieutenant governor said, it could be by one of your competitive organizations. It could be somebody within your organization who thinks you're putting people at risk. And if it gets called out to the state and they investigate, there better have been something in place indicating why you were business essential for those purposes. All of us, I realize, are dedicated professionals. We greatly appreciate that, right? You're doing amazing things for the university. You're keeping us going. It shows that you're committed, you're dedicated, and you are good, loving members of this organization. But what we have to do is really think about the health and wellness of our community and our families and what you might be bringing home unintentionally or sharing with others. Even if you need to take a trip to a grocery store and you're there, but you pick something up at the university, you're asymptomatic or mildly symptomatic, you sneeze, you cough, you speak loudly and aggressively because of the distance you're keeping. And because of that, we have plumes of spittle and fluid from our mucous membranes that go out into the environment, and you may unintentionally get somebody sick. You may actually unintentionally contribute to somebody's hospitalization or death inadvertently, and none of us would want that on our consciences. So please, only if needed.
There have been a few questions about graduation, whether it will be pushed to being early or pushed to being back in the fall. Can you touch on this a little bit?
Yeah, so graduation, the commencements, well, those who are going to graduate are going to graduate. Commencement celebration, the ceremony itself is just that. It's a celebration. The majority of universities have canceled it or pushed it off until the fall. The difficulty that we have at our organization is we graduate primarily medical students and pharmacy students. Although we do have a fairly large proportion of research students with master's degrees and one PhD graduate this year, we know they're going to leave the area, especially those who have mandatory internships and residencies. They're not going to be available. They're going to be working long hours, hard hours, and they're just not going to be able to come back for a graduation within the short term. We hope to be able to provide a opportunity for a formal celebration for those who can make it. And we're looking right now at potentially July 26th, and we'll send additional information as that evolves. But we do recognize that we need to do something to celebrate now. And as far as we know, at least speaking with the Inter-University Council, we'll be the only one in the state to offer something unique, which is a virtual celebration, which would include an opportunity for all of you to have a personalized video, ideally with family members or professional peers and mentors that you respect, maintaining appropriate distance and appropriate isolation procedures, but allowing you to get virtually gowned, to have it recorded, to have you virtually walk across the commencement stage and receive your diplomas, and for us to have our speakers and the commencement address, and then to provide all of you with a very professionally constructed movie that will show a seamless commencement as though you were there and it was taking place in real time. That is the current plan, although we are going to send a survey out to our students that needs to be responded to rapidly, as the production company that we've already engaged with needs to start moving on this very quickly. In addition, we realize that this is not ideal for our students, and we need to do something a little bit more meaningful and personalized besides just the ability to have these personalized videos. We're also purchasing some very high quality frames for your diplomas, so that we're giving you something special and a little bit different than we would have been able to do at other times and going into the future.
What is your opinion about making wearing masks on campus mandatory?
So wearing masks on campus is something that we are not recommending. The CDC is not recommending. The Department of Health is not recommending. So N95 masks, the effective masks that should be worn by healthcare providers and by those who are first responders, protect you from getting contaminated from others who are infected on the outside. And those wearing surgical masks, the kind we're used to seeing in operating rooms or when we're performing procedures in the emergency department or on the floors, those help to reduce the overall risk to others around us by preventing what we might have from getting out if we were to cough, to sneeze, or when you speak aggressively and have salivary components released into the atmosphere. Since we're keeping people at least 6 feet apart, we have very limited footprint on campus. In fact, I'm one of the few people who's been occasionally going on campus to look at the areas and to make sure that we're compliant. I'll tell you that most rooms, most of the large hallways have less than one person present at any one time. Even going into the research areas, I found that I came across 2 people and each of them were isolated by more than 100 feet around them. So the masks won't help you with contact for virus that may be sitting on surfaces and can last up to 3 days, potentially more, depending on the surfaces. That's going to be about hand washing. So right now, social distancing, and really it should be 6 feet. That's the key for us. We're also fortunate on campus that we are a commercial grade building, although we don't have the same air exchange cycles that would be present in a hospital and certainly not in an ICU. We do have much more rapid air exchanges taking place than you would have in your home, which markedly reduces the ability for contaminants to be present in the environment. So I don't think it's necessary, and the CDC and the State Department of Health have also agreed with that. Any other questions?
The final question for today: President Trump extended COVID-19 social distancing guidelines to April 30th. Will NeoMed follow this recommendation?
So NeoMed's recommendation is that we are doing this with no intended end date. When we determine that it's safe, then we'll come on with a communication that looks to modify the way we are doing things. But for right now, we do not have an end date to what we're doing, and that's intentional. I We originally picked April 6th for ending our need for teleeducation, but in fact, we know we're going to exceed that. So our latest communication was until further notice. We just don't know at this time. Predictions on how long this is going to be present and be a risk to our community are unclear. They're certainly going to be with us for at least 6 weeks. Some speculate 6 months. We certainly hope it doesn't go that far out, but we are going to be prepared for whatever is required to ensure the health and safety of our campus. Thank you all. I'll continue to give updates as needed. My intent is at least Monday every week to give you an update on new information. If something dramatic changes, we will adapt and do something sooner. In the meantime, please watch for email communications and communications on Pulse. I want to thank all of you once again, and I'm very proud to be part of this incredible team of individuals. We have stepped up literally overnight to continue to do everything we do. We have managed to continue to pay our employees at a time when most organizations are having to lay off individuals, and it helps to ensure our long-term sustainability and that of the family members that are part of NeoMed. So thank you all.